psychological care, and mental health management to cope in the new normal. To ensure mental health safety of frontline workers, it is important to rotate workers regularly from high stress to low stress jobs, having them take regular breaks, having mental health services accessible and available to them for relaxation and stress reduction at all times. It's important that employees share workload and responsibilities so that one doesn't feel overburdened with duties. Also, as we have discussed earlier, it's important to make sure that these workers do not face stigma, and assessment of moral injury is very important, and counseling for it is suggested to be mandatory for all. Feelings of boredom and unproductivity are striking the most during this time. To combat it, certain practices can be followed by students and the workforce. These are setting small but specific and achievable goals for ourselves every day and trying our best to reach that goal. Do not feel disheartened or demotivated if we are unable to achieve certain goals on the desired day and keep trying till we get there. Taking frequent breaks between work is important and knowing that it's okay if you had a rough and a non productive day. Making a separate work and study space to maintain work life balance and establishing focus is essential. And to not be productive 24/7 and work around everything in moderation. Planning important tasks when you feel the most energetic in the day and when you are in a good mood is helpful. That is the best time to do any analytical work, and plotting your day helps you understand when and where to invest your energy. Mental health and well being for children are important and is of crucial importance for parents and caregivers into maintaining and understanding need of their children with utmost sensitivity and empathy. Certain strategies can be used for children in order to understand their mental health concerns and help them cope with it. Just because children are not expressing concerns, that does not mean it is not affecting them. Children internalize and externalize their experiences. Children will be looking at their parents and caregivers for consolation. They have to be a model for them. If they see their parents and caregivers in stress, so will they be. It's important to let them express all of their apprehension, fears, feelings, and thoughts and address their concern. Be as honest as possible and give age appropriate information to them regarding this pandemic and the safety concern. Try to not discuss stressful details related to COVID in front of children, as children can learn fear from their parents. Writing, drawing, coloring are helpful strategies to let children express themselves. Not discussing stressful details is important. Maintaining a familiar routine for children is important. Keeping them engaged in age appropriate activities is also a very essential way. Children should be encouraged to continue playing and socializing with others through video call, phone call, and at home with their family members. It's recommended to create a daily schedule that includes learning activities, especially for hours in which that child may typically be in school. It is essential to contact a certified mental health professional when an individual is suffering from severe distress symptoms that last more than 2 weeks and if there is a lack of support system. Also, for those who have a history of psychological disturbances and are currently having recurrence of symptoms of previously treated mental disorder, also must get in touch with their doctors or therapist. If the individual is having disturbances that are causing hindrance in self-care and daily functioning, it is essential for them to seek professional help. Seeking help doesn't make a person weak or incompetent. It is in fact a sign of strength and courage.